As we have heard already, Bradley has a lot of new rules and changes on campus, but the most important are the guidelines surrounding the health of students, faculty, and staff. To better understand how Bradley will conduct COVID-19 testing and what students should do if they're sick, we are talking to Director of Health Services, Dr. Jessica Higgs. Welcome. Thank you so much, Dr. Higgs, for joining us today.
Thanks for having me.
Of course. So my first question for you is, the university is testing about 250 to 300 students weekly. Why that specific number?
So when we were looking at different testing strategies over the summer, one that we kind of settled on was the surveillance testing that gives us an estimate of the prevalence rate on campus. We met with the mathematics department and modeled what a 5% prevalence rate, which was kind of a little lower than what was going on in the state of Illinois at the time, to give us 90% confidence of that was an actual number going on campus, and so that's where the 250 number came from.
Thank you. My next question is, how does a student know that they're going to be selected randomly for testing?
So they will get an email on Sunday. Currently those emails are going out about 1 o'clock on Sunday afternoon that they have been selected, and it gives them directions then on how to make the appointment for throughout the following week. And then after they make the appointment, it gives them directions on where to go to get tested.
So I've been seeing every single day in my email coming up, we have daily symptom tracker emails. What are those about, and why are we receiving them?
So we're just sending out sort of our friendly reminder of take a moment and see how you're feeling today. So if you answer those questions and it gives you a red X saying that you shouldn't go to campus or call health center to go over it further, it may just be that you're having allergies or something else that is normal for you, but it gives you a moment to say, is it really normal for me, or am I feeling sick? So it's really kind of a daily reminder of, we really want you to pay attention to how you're feeling before you decide to go to class.
And if a student decides to go to the Civic Center, let's say, for testing, how can we make sure that that test counts at Bradley University?
So we have been trying to get that message out. We would much rather students come to the health center, or at least notify us before they go, or if they go, notify us that they went. The testing takes about 5 to 7 days to turn around at the Civic Center currently, where we're getting our results back in about 24 hours. So there's a longer lag time with those tests. And then we're relying on the student to let us know when that test is positive or not, so that we can do contact tracing and make sure that anyone who needs to be in quarantine is. So we'd rather go through the student center or through health center when possible. I know that's not always possible, so they just need to notify us if they're going to the Civic Center.
And if a student isn't randomly selected, will they have to pay a price in order to get a test here?
So if they come over and they are symptomatic or a positive close contact, we'll ask about their insurance information. If they don't have insurance, we don't want that to be a barrier, or they're unsure of their insurance, we really don't want that to be a barrier for them to be tested. So if they come over, we will make sure that it gets done. There will most likely be zero fee associated with it.
Oh, amazing. That's really
so
good to know.
Only if they are completely asymptomatic, no symptoms, and they have no positive close contacts, that's when we actually encourage them to go to the Civic Center, because that's just a random screen, and that should go to the Civic Center.
So as we know, a lot of students are probably going to be asymptomatic. What are you supposed to do if you're living with a roommate and you're on campus for right now?
So we know that a lot are asymptomatic, but we have found through the tests that we've had positive so far that they have some symptoms, either might be mild and may not have really attributed it to it, but there may be something going on. So that's another reason for the symptom tracker, just to be thinking about, oh, I have a stuffy nose. But if a student is positive or is having symptoms and they haven't had their test back yet, they should quarantine, which means spending as little time around other people as possible, trying to find a space where they're not going to class. They maybe have a friend running to get them food for lunch, but making as little contact or effort as possible when they do have to go out somewhere, to wear a mask, wash their hands, physically distance, all the things that we're supposed to be doing.
Okay. And what advice would you give to students living with multiple roommates?
Again, paying attention to what you're doing in the house. So often if it's multiple roommates, they're off campus in an apartment, and can look at the furniture, spacing, or how much time they spend in the room, how much contact they actually have with some of the roommates, how many bathrooms there are, and maybe divvying up who's using what bathroom. So maybe it only takes out a few roommates. But I mean, just like at home, if one of your parents tested positive, the whole house would have to quarantine. So that's pretty much going to be what's going on campus as well.
All right. Thank you so much, Dr. Higgs. That was my last question for you today. And up next, we have Larry sitting down with Bradley's soccer coach, Jim DeRose. We'll be right back.